Okay, let's jump right into this. We are going to unpack a truly life-saving protocol today by taking some pretty complex clinical data and turning it into a clear, actionable survival guide for managing dog bites. Rabies is an incredibly serious disease, but here is the most important thing you need to know. With the right first aid management and immunization, it is entirely preventable. So this explainer is going to walk you through exactly what to do step by step.
To make this super easy to follow, we've broken the whole process down into 5 key areas. We'll cover how to categorize the bite, crucial first aid steps, the anti-rabies vaccine, the anti-rabies serum, and finally, some specific post-exposure scenarios based on your personal immunization history. All right, let's kick things off with Section 1, categorizing the dog bite.
Literally, everything in rabies management depends on getting this first step right, assessing the severity of the exposure. Let's look at Category I. If you were just feeding the dog, petting it, or if it licked completely intact, unbroken skin, you fall right here into Category I. And the great news? No further medical post-exposure prophylaxis, or PEP, is required. You're totally safe. But the second your skin is compromised, we're entering much more serious territory.
Now, this is where we have to draw a hard line between Category 2 and Category 3. A Category 2 exposure is a scratch or superficial bite without any bleeding. You're definitely going to need first aid, the anti-rabies vaccine, and a tetanus shot if you aren't up to date. However, if there is any bleeding at all, a transdermal bite that breaks the skin, or a lick on skin that was already scraped or broken, that immediately escalates you to a Category 3 emergency. Why? Because the animal's saliva has come into direct contact with your bloodstream. So, on top of the first aid and vaccines, you now absolutely require rabies immunoglobulin, which is also known as the serum.
Moving right along to Section 2, crucial first aid steps.
So you know your category, but what do you do in those chaotic first few minutes? Well, the most fascinating part of this protocol is that your immediate, life-saving actions don't require any medical equipment at all. The very first thing you must do, and I can't stress this enough, is aggressively wash the wound with soap and running water. You are literally trying to mechanically wash the virus out of the tissue. Second, resist the urge to get the wound stitched up right away. If suturing is completely unavoidable, the protocol says you should ideally wait 24 to 48 hours so you don't accidentally trap the virus deep inside the wound. And finally, if it's possible, keep the dog under observation for 10 days to check for signs of rabies.
Okay, Section 3, the Anti-Rabies Vaccine, or ARV.
Let's talk about your primary active defense mechanism, the vaccine. This trains your immune system to fight the virus long-term. But location matters immensely here. It is absolutely vital that the ARV is injected into the deltoid region of your arm, or the outer mid-thigh for young kids. Under no circumstances should this vaccine be given in the gluteal region, no shots in the buttocks. Doing so is strictly prohibited because absorption in that fatty tissue is highly unpredictable and can actually cause the vaccine to fail entirely.
When you get to the clinic, there are 2 different paths for your vaccine schedule, depending on how they administer it. If they use the intradermal route, just right under the top layer of skin, you're looking at a 4-dose regimen on days 0, 3, 7, and 28. That involves a tiny 0.1 milliliter dose placed in 2 different sites, usually 1 on each arm. On the flip side, if they go intramuscular, it's a 5-dose regimen. You'll get a larger 0.5.
Which brings us to Section 4, Anti-Rabies Serum Explained.
So the vaccine is great for building long-term immunity, but if you've suffered a severe Category 3 exposure, you just do not have time to wait for the vaccine to kick in. You need the Anti-Rabies Serum, or ARS. Think of this as immediate passive immunity. It's basically a dose of pre-made antibodies that go straight to work fighting the virus at the wound site, while your body is still figuring out how to make its own. But because it is a foreign serum, doctors must always give a small test dose first to make sure you don't have an allergic or hypersensitive reaction.
There are actually 2 distinct types of serum you might encounter, human-derived and horse-derived. The horse-derived serum requires double the dosage, 40 international units per kilogram of body weight compared to just 20 for the human serum. It also changes how the doctor applies it. With human serum, 75% goes directly into and around the wound itself, and the rest goes into the muscle. But with the horse serum, it's a straight 50-50 split between the wound and the muscle.
Now, time is of the essence with the serum. To get the maximum benefit, you really want this administered within the first 24 hours of the bite. That's your golden window. You technically have up to 7 days, but after that 1-week mark, your active vaccine has usually started producing enough of your own antibodies that the serum just isn't helpful anymore. All right, moving into our final section,
Post-exposure scenarios.
Let's look at how your personal medical history changes this whole flowchart. First up, the fully immunized person. This means you have a documented history of finishing a pre-exposure regimen, which, by the way, happens on day 0, 7, and 28 and is completely safe for pregnant women, or you've completed a full post-exposure regimen from a past bite. If you fall into this bucket, your treatment for a new bite is incredibly simplified. You just need 2 quick ARV booster shots on day 0 and 3.
Now you might be thinking, wait, what about the serum? Don't I need that for a severe bite? Actually, no. Even for a nasty Category 3 bite, a fully immunized person does not get the anti-rabies serum. Here's why. Your body's memory B cells are already primed and ready to fight. If we introduce that pre-made serum, it actually suppresses your immune system's own rapid booster response. Basically, the serum just gets in the way of your body doing its job.
Let's look at the partially immunized patient next.
Because, let's be real, life happens, and medical histories aren't always perfectly complete. So what happens if you started a vaccine course a while back, but you skipped the last shot, and now you've been bitten again? Are you protected?
The protocol handles this gray area by breaking it into 2 very specific scenarios. In Scenario A, your incomplete doses were recent, within the last 3 months, and you have proof that you got at least 2 shots. If that's you, you're treated basically like a fully immunized person. No serum needed, just 2 boosters on day 0 and 3. But look at Scenario B. If more than 3 months have passed, or if you only ever got 1 single shot, your partial immunity doesn't count. You are treated as completely unvaccinated, meaning you need the full serum, and you literally have to start the whole grueling vaccine process over from day 0.
And that brings us to the ultimate takeaway of this explainer. Rabies is 100% preventable when you follow the exact steps we've laid out today. But given just how complex these pathways can be, navigating the categories, the strict timelines, the differences between vaccines and serums, and your own immunization history, ask yourself, are you completely confident you and your loved ones would know exactly what to do in minute 1 of a dog bite?